Hi everyone, welcome back to the video. Today, the new video is on a condition called flail chest. We'll talk about all very important what we have to know, what we the questions coming, what we have to give importance with respect to flail chest. So, according to ATLS, it is a manual on trauma management. It is a controversy that we have different two definitions. Like the Bailey tells us, gives us another definition to flail chest, and according to this manual ATLS, we have another definition. But in case of trauma, ATLS guidelines is which is a standard one, which is used overall all over the world. So we'll go with the ATLS definition of flail chest. So the flail chest is a fracture of two or more consecutive ribs at two or more places. So these are the keywords. Consecutive is a keyword that there should be fracture of two or more consecutive ribs and also at two or more places. And with respect to Bailey, the definition of flail chest is a fracture of three or more consecutive ribs. So I'll give you an example of two patients which comes to the emergency. Patient A and patient B, just analyze the condition. The patient A, he comes with a rib fracture. So here we can see on the first rib there is three fracture, second rib two fracture, and third rib with two fracture. And patient B, here we have the three fracture, two one fracture, two fracture, one and one fracture. So what do you think with respect to A and B patients who is having the flail chest condition which we just talked about according to ATLS definition? Patient A is having fracture, yeah, patient B or is having the flail chest condition, or both the patients are having. So it is clear from the definition is that there should be two or more consecutive rib fracture, two or more places. So see here we have consecutive rib fracture at two or more places, but here this is and here in case of B patient, there is no consecutive rib fracture. See here it is only a one fracture. There should be two or more places fracture and consecutive ribs. So this is not a condition of flail chest. It is just a condition called multiple rib fracture. That is, multiple ribs have been fractured. To call a flail chest condition, it should be two or more consecutive ribs with two or more places. So this is a flail chest segment. So this is what we have to know from the definition of flail chest and also the practical understanding of the condition called flail chest. So after this basic understanding of flail chest, the definition will come to know understanding, which is very important, is that the problems associated with flail chest. There are two main problems associated with the flail chest. One is paradoxical breathing with respect to the chest wall movement. Here, I'll elaborate on this. Like we know the flail chest segment. It is so here it is broken off from the chest wall. So once a patient is breathing, what happens is that during breathing, inhalation, the chest wall will come out, but this segment will go inside. And once the patient is exhaling, the chest wall will come inside, but the flail segment will come outside. So that is paradoxical. So that is what is meant by paradoxical chest wall movement. So, and the important thing to note here is that all the patients with the flail chest condition will not have this paradoxical chest wall movement. Only some patient with flail chest will show this. And the second problem associated with flail chest is a pulmonary contusion. And the very important MCQs which has been asked continuously is that what is the most common cause of death of due to flail chest? It is this very severe important condition which is pulmonary contusion. So It's like we know the fly says segment. So what happens is that this segment will break and go and hit the lung, causing this pulmonary condition, and which is a cause of death. So that is the two main problems. And comes to the coming to the management of flail chest, we give the adequate analgesia, and this can be given through thoracic epidural and catheter. And also the second management is that a patient with flail chest, we give after giving the painkillers, we give the oxygen. And if after this two management, even after this, despite this two management procedures, the respiratory rate of the patient is more than 20 per minute, and the partial oxygen pressure is less than 60 millimeter mercury, then we'll go for this management, that is IPPV, which is called intermittent positive pressure ventilation. We'll go for this. And even the condition of patient is so severe that even this management fails, then the last thing will go for is surgical fixation of that flail segment. And this is it is not done. Surgical fixation is not required mostly. It is very in extreme conditions the patient will go for surgical fixation, because even before that the patient will get benefited with the previous managements. So this is overall thing about flail chest, starting with the definition, that is two or more consecutive rib fracture, two or more places, with respect to practical understanding with the help of this diagram. I hope this is clear what is flail chest. And we talked about the two main problems like paradoxical breathing, and it is not like every patient with flail chest condition will see this paradoxical chest wall movement. It is only seen in some patients. And the most common cause of death out of flail chest is a pulmonary condition, that is this segment is going and hitting the lung. And the management is with the help of analgesia and also the oxygen. If those management fails, that is even after using this management, the respiratory rate of the patient is more than 20 and the PO2 is less than 60 millimeter mercury, will go for IPPV, which is intermittent positive pressure ventilation. Even in extreme situation, even that fails, will go for surgical fixation of that flail segment. So this is overall about the flail chest condition. Thank you for the attention, and stay tuned to the next videos, which will discuss on various other condition. The next video will be based on pneumothorax. Thank you.